welcome back. If this is not your first time tuning in to Before the Medicine podcast, I'm your host, Akeira Johnson, physician, author, and really excited to be here. So, this is episode 2. Last week, we got a chance to hear the inaugural episode and brand inception, which ended up being a story of how I got to this place of my own health journey and wanting to create something from that space. So, in this episode, just building on that, I like to go into how I teach personal transformation and mindset shifts in wellness and how I get results and success with my patients. I approach most of my coaching from a platform of 5 pillars. And this structure, I think it makes for sustainable wellness that wherever you are in your journey, you should be able to see some level of result. I would really like you to stay tuned for pillar number 4. I'll go through all 5 sequentially because that one is my favorite one. So I really enjoy talking about that one specifically. So let's start just right at the beginning. Number 1, practice over prescription. And I have some notes in front of me just so I stay structured and on time and respect the time that you are sharing with me, which of course I appreciate so much. So I want you to start thinking about wellness as something you do and not necessarily something you take. That's what this first pillar is about. I'm not here to complicate your life or add another task to your already overwhelming to-do list. And remember, I started this journey with my own health transformation and wellness wake-up call. So I needed something that would work with a full-time professional schedule, a full personal schedule, and I use these pillars on myself. So where I built this was something that had to be able to fit into someone who had a full life. I'm here to help you shift how you see your health from a checkbox item to an actual daily experience you live, something you look forward to, something you wouldn't think of missing because it feels good, not because you're forcing it. The wellness that I teach, it isn't about pills, it's not about potions, it's not about products, though there are times where any one of those things may have their place, but the focus isn't any one of those individually all the time. My approach mainly is about the practices that you weave into your day, the choices that you make, the habits that you build. With this pillar, number 1, consider what if your health wasn't something you had to do, but instead it was something you got to be. How would that change your view of your current health status? If you're listening here on YouTube, you can write this in the comments below. We can interact in that way. And throughout the podcast today, we can do that with these different pillars. So number 2, nourishing and not overwhelming. This pillar is about aligning with ease and sustainability over intensity. I want you to be honest with yourself and with me, not that you aren't usually, but do you cringe at the thought of your next checkup, whoever that may be with? So whether it's primary care, whether it's specialty care, there was a time where I did too. Do you currently hear messages or messaging about your body and your health status as a proof of failure, as evidence that you need to do better? That probably doesn't feel too good, and it doesn't feel supportive or compassionate. If wellness feels like something you're trying to figure out outside or separate from you, it likely feels like a thing you have to conquer, something that only pills, procedures, or some sort of punishing routine can fix. And I want to help you shift that mindset. Wellness should be nourishing. That's what this pillar is all about. It should be restorative. It should be something that feels like it's coming home to yourself. I talked about that in episode 1 and how I got through my own health journey with aligning that connection or realigning a connection with myself, and where I felt like I was coming home to my body or reestablishing a new relationship that I hadn't really had before. Just this connectedness that felt so soothing and familiar and supportive. Something that feels like coming home to yourself shouldn't feel like it's another battle to fight. This is you. This is me. This is however you want to put it. But this is you you're talking about. It's a relationship that it should be supportive, it should be approachable, not a constant reminder of a standard that you just can't reach. And we can start by trading the intensity for ease, overwhelm for sustainability, and shame for compassion. Simply by taking a place or taking your own place as a supportive lead. Take the lead role within yourself. You don't have to wait for something outside of you. You don't have to wait for someone outside of you. And I'm saying that as, again, a clinician, a doctor. I would encourage you to take that lead role for yourself. So in this pillar, I'd like you to think about the following. What if taking care of yourself actually felt good? How would you show up for yourself? How would you show up for yourself differently? Leave that comment below if you feel comfortable sharing. Pillar number 3, have you heard that beliefs shape your actions? And then in turn, actions shape your results. I'm here to tell you that they do. If you can continue to ask yourself these questions, what have you been told about your health? Your ability. We start over. Pillar number 3. Have you heard that beliefs shape your actions? These actions then shape your results. And if you've not heard that, I'm here to let you know they do. If I can continue asking you questions, I have some more even after this, so bear with me. But what have you been told about your health? What have you been told about your ability to heal and to live well? What about your body, its healing function, its healing potential? What has that questioning been like for you? When you think about those questions, tell me or tell yourself, how much of that do you actually believe is within your control? And how much of that feels completely outside of your control? Think about what has been assigned to, let's say, bad genetics. When you think about conversations you've had with family, friends, or even healthcare partners, sometimes you hear it in the way of, well, you've always been that way. Let's say it's your parents telling you something about yourself or someone who's known you for a long time. And subsequently, then you start to think about your health or your wellness in ways that things just can't be accomplished or things that potentially should only be able to be accomplished in a very specific way. And if we're being honest here, the limiting programming of some of that messaging, it leads to areas where then you may hold mistrust, not just in your own body, but the healthcare system itself. There may have been conditions in which you were given the mindset to understand the possibility of a life where wellness felt unnatural, or maybe it did feel very natural based on some of that programming. But here's the truth. Your beliefs, whichever way they go, they create your reality. And the stories that are rehearsed to you and that you then rehearse about your body, about your capacity, your worthiness, they begin to shape the choices that you make. I want you to really think about that. So if we started with rewriting some of those stories, if you feel moved to rewrite a limiting healing belief in the comments, then I'd like you to consider doing that. I can give an example here. This happens all the time in my clinical practice. Well, everyone in my family has fill in the blank. And so I know that I'm going to get it. And this is a response I'll get very confidently, without patients even thinking about it, without them even trying to think about another outcome. And sometimes it's it's sad to think about that they don't even see another option, not because of what they see as potential, but because of not seeing a way out. Number 4, as I mentioned before, this one's my favorite. Lifestyle planning. This pillar for me is super important. It's a non-negotiable, and I really think it's fun to do. It's fun to talk about as well. This is a practical, personalized, actionable approach. And again, it's my favorite one to teach. You plan your career, you plan your finances, you plan your vacations, your kids' schedules, you name it. There's a plan for it. But have you ever actually planned your wellness lifestyle. Here's what I mean by that. I'm not talking about just clean eating or joining a gym or making a New Year's resolution that by January, let's say 13th, has fizzled out or barely making it to February. But I actually mean an individualized, actionable approach and planning that creates transformational shifts that you can maintain. A wellness map that you actually understand, practices that fit your life, your real life at that. A health profile that evolves because you designed it or you co-designed it to evolve with you. Most people are winging their wellness. Let's just be honest. They're reacting to symptoms, following trends, hoping that something sticks, or they're waiting on a clinician just to tell them what to do. It's one of my favorite things to do in clinic, actually give out options to patients so that they make decisions with me, with my expertise. I understand if they're coming to me for the knowledge that I have in the healthcare field, but I always want to make a decision with them, with you, with your understanding of what your options are. Some patients enjoy this. Some get a little frustrated by it and want to know, well, what am I paying you for? And it's not that they don't want to think for themselves. I think it's a new paradigm in the presentation, the thinking that it's maybe not been presented in that way. But usually once I can explain it, most patients are excited that they have a partner in their healthcare and there's someone who can map out these decisions with them for a lifestyle that they will be able to agree or disagree will work for them. And I could talk about this forever. So there'll probably be a future episode where I just dedicate it to lifestyle planning. But right now, with this pillar, what if you had your own plan, one that was actually built for you? What would you see how beneficial this could be in an approach to your treatment, for your wellness, for your living in health? How do you see that working for you? I'd like you to put that in the comments as well, if you're able to. And lastly, number 5. So this pillar is all about meeting you where you are. There's no judgment here. There are no prerequisites, and it starts and ends with inclusivity. Listen, you are not behind. I'll say that again. You're not behind. I just don't believe in that. You're never behind if you're ready to take accountability today. You can only start where you are. And I would say probably second to number 4, this is my next favorite pillar because I get to speak so much life into you as I had to do myself. And I was wondering, how did I get here? How did things get this bad seemingly overnight? Well, I can only start where I am, and I just had to go forward from there. But that being said, waiting on the right moment, it doesn't work because there's no such thing as a guaranteed perfect time. At the time of this recording, we're 11 months into the year, and January 1st isn't coming to save you. It's not coming to save me. It can't help you today where you are, but today can. Again, starting exactly where you are. So even that, if that's with a thought, permission slip, an acknowledgement, it's still a start. And so that counts for something. And so take that as a win. That matters. You can just make it count where it is in this moment. How can you actually do this? Sometimes only you can decide that. As a clinician, I can probably help you and work through some of that with you, clinician and coach, I guess. But most people can't answer this question for themselves. If they really just make it simple, don't overcomplicate it. You give yourself the self-love, the support that you need right now, and really you can see yourself the rest of the way through. It's not that complicated. Once you learn that as a skill, this compassionate, present moment accountability, you instantly begin to thrive in all aspects of your life, but especially in your wellness. There's both a lesson and a reward in seeing yourself exactly where you are and exactly as you are. So here's the last set of questions for the pillars. Ask yourself and answer, where are you? Where are you really? And more importantly, can you honor that state of presence without judgment? So This episode, I think it was kind of fun and it gives you the foundation of my coaching, my style. But if there is a specific pillar that resonated with you, or when you think about it a bit more resonates with you, I would love to hear about it. Think about it, come back, comment below. If there's a place in your wellness journey that you feel that you need the most support, I want you to write that in the comments so that I know and it can help me for future topics or as I'm curating different resources, which is what this platform is about. You can put it in the comment section. You can DM me on my Instagram, which I will have that linked in the show notes, and share in just whatever way you feel comfortable. I also invite you to check out the blog that will have expanded guides, pill frameworks, and actionable strategies. I'll leave the website as well in the show notes, and consider subscribing to the newsletter. That's, I would say, more of a concise format of the podcast show, but some people like to read, or just maybe you go back and it's a way that you can just get the information in a different format and see what sticks with you in a different aspect of receiving it. And of course, I always invite you to subscribe to the podcast for ongoing in-depth conversations on healing that begins with listening and not prescribing. So I invite you to get out of here, go live your life, tend to your lifestyle, one that supports you and where you're going, and not where you have been stuck and barely surviving. Until next time, thank you.